Hey guys, I know it's been a while since I last updated. As you can see, I'm in the hospital again. So basically, I was in for 5 weeks, and then I was discharged during Christmas time for 10 days, and things didn't go well at all. So I was readmitted just over 2 weeks ago. So in total, my probable discharge date is this Thursday, so in total it would be about 2 months inpatient. Yeah, my body wasn't well. It couldn't handle the strain I was putting it under through restricting and taking laxatives and such. So I guess as you keep going into your behaviors, the more and more you do it and the longer you do it, the less it takes for your body to react and essentially give out. So a few people have asked me some questions to talk about. One of them was the feeding tube. Does it hurt? It hurts a lot going in, and once it's in, for me, there's a lot of pain in my nose and in my throat, so I typically use Halls just to kind of help soothe my throat. And eating with a feeding tube is a little bit weird. Sometimes sticky things can get stuck and it feels like you're choking. So just as long as, for the most part, it's pretty normal. But I had like a caramel thing and I felt like I was choking essentially. Also, they get clogged. They can get clogged easily. I had a smaller one in earlier today and it got clogged. So I got replaced with this one and it's a bit bigger. So this is my 4th reinsertion in the last 2 weeks, so it's kind of like a pain in the arse, just because things get clogged and I pull things out when I'm really upset and all my control is taken away and I don't know how to express my feelings, so that's kind of what happened with me pulling it out. Weight gain. So obviously that's going to happen. Especially being on IV all the time and on a feeding tube and such and renourishment in the hospital. It feels horrible. There's a lot of bloating and stomach distension, and that's a very normal part in refeeding. However, it's extremely uncomfortable. I'm not okay with it. I'm not happy with it, but it just is. It's reality. It's just the reality of getting to a point where your body needs that medical intervention, and what comes out of it is a little bit of weight gain. So dealing with it, I'm not. I'm just kind of being, but I don't know. When I get out of hospital, I just feel like I won't be able to handle it because it's really hard to be in my body, and that's something that I'm going to work on in therapy and such. So the plan from now on, I have an outpatient treatment team, so I'll go to a group a week, and it's called Self-Compassion, and that's with the Eating Disorder Clinic. I'll see an eating disorder specialist doctor regularly, as well as my general practitioner. I will see a therapist, as well as a psychiatrist regularly, and that is to ensure that I stay as well as I can in the community until I can get somewhere residential. So right now my counselor and I are working on getting funding out of Canada, out of Canada funding for treatment at Remuda Ranch. It is a quite extensive process, and it's going to take a while, but we're working on it. Apparently a few people have been approved from Canada to go once all programs are exhausted here in this country. So a lot of programs do require a high degree of medical stability, which I am unable to maintain on my own, so I don't qualify for them. So that's why I can apply for funding, and I will make sure to update you guys as to how that goes and what happens. So stay tuned, subscribe. I've also made another video a little bit about my journey so far that I'm going to upload once I'm discharged. So yeah, I hope you're doing well and hang in there. Champions, yeah. Bye.